dentists have one of the highest suicide rates. And one of the books I read talked about, unfortunately, anytime that does happen, there's an autopsy performed typically. And the dentist had 800 times more mercury in their pituitary gland than the average person that had also committed suicide. Mm-hmm.
Welcome back to another episode of the Tooth or Dare podcast, Peeps with your peep, Irene. I'm so excited to be joined today by a wonderful guest that's going to share a lot of information about tongue posture and breathing and all of the fun myofunctional therapy things that I'm very interested in discussing all the time. So it's nice to have a counterpart. I'd like to welcome you all to Dr. Kalli Hale.
Thank you so much.
Welcome to the podcast. I'm very excited to talk to you. You graduated from the University of Texas in Houston, correct?
Yes.
You're the Chief Dental Officer of Toothpillow, which I'm very excited to talk about. And you have revolutionized pediatric dental care by providing very supportive and engaging treatment options for kids. So this is, kids stuff and myo stuff is like my goal. I'm covered in like little tattoos because
stop! That's
my social
amazing.
media, but I do these little tattoos with kids at the office. So by the end of the week, I'm usually covered in them. So kid stuff is very exciting. But like, let's talk about you. Where did you come from? Tell me about birth. What was birth like?
I was going to say, all the way back. Yeah. I'd love to tell my story.
We like to go to the beginning. Well,
I was breastfed. And so I had, actually was born with a horrible tongue tie. It's part of my story, actually. So we can go back to birth.
Start from that beginning.
Yeah, I will. I was born in Texas. I've always been in Texas. I live in Texas now. My practices are in the greater Houston area. But thank you for having me. This is so great. I love getting on here and talking about this. Toothpillow is one of my biggest passions, and helping kids to breathe better and sleep better, to change the way they turn into adults, is just my jam. Like, it's just the most fun thing. And without myofunctional therapists like you, my job would be so much harder. So we have so much cool stuff to talk about. But yeah, I grew up in dentistry. So I'm one of 5 in my immediate family of dentists, married to a dentist. My sister's a dentist. My parents are dentists.
No way.
So this is all we do. Yeah. And I remember back when everything was paper charts, and I would file charts and call patients and tell them, it'd be like the 10-year-old on the phone, probably not really 10, breaking labor laws, but like, hey, you're due for your checkup and cleaning, and I just loved it. And I feel like it was always going to be what I ended up doing. I had a really tremendous childhood, though. I grew up on a farm, and we had horses and chickens and goats and cows and just all the things. We'd have to get up really early. I was homeschooled,
like
actually.
Farm or a hobby farm?
No, hobby farm. Just my parents whisked my sister and I away to this like little oasis of 80 something acres where we were just raised in the most beautiful fashion. I was actually a very competitive pianist. So up until going to college, my sport was piano playing. And I still to this day love it. I think it was one of the best things they could have taught me, because it's a skill that you can have and enjoy like throughout all of your life. I did a little gymnastics and dance, but you can outgrow that to some extent. So music was my life. And then when it came time, I went to Texas A&M University for college. And when it came time to decide what I wanted to do, it was honestly a decision of like, do I want to pursue music or do I want to go the medical dental route? And I'm happy to say, I think I made definitely the right decision for my career, and I get to do both. I can still play the piano and all of that, but it's not how I make my living. So
that is really cool. What was the entrance like? What was your undergrad degree in?
So I always knew I was going to go to dental school once I actually went to college. So it was like, if I'm going to go to Texas A&M, it's going to be a science degree to help with my dental school application. So I was a biology major.
Biology. And then how competitive was it to get into dental school at that particular school? Extremely
competitive, fairly traumatic, blacked it out. Yeah, absolutely.
Tell us more.
So it has gotten exceedingly more competitive because of just how healthcare is going in the United States right now. And the fact that you can get out of dental school and still be a small business owner, you're not working for large hospitals and corporations. The pool for dental applicants was over 1,000, 1,500 or something. I remember it being an astronomical number, and there was only a few hundred seats in the country. My class only had 80. We lost some the first year, actually. I was reminiscing on this with a colleague the other day.
Really?
So you have like 80 spots in Houston at that time. I think they're up to 100 now, maybe, like, because there's a new school. It's beautiful. But it was a very small pool of people. So your dental admission test score had to be really high. Obviously, your grades had to be high. But then you had to have a good personality, which I think is the most important of all of that, you know? So I was like, if I can just get an interview, I think they'll understand like my heart with all this. Yeah. But yeah, it's very, very competitive. I mean, I still think there's obviously, we need physicians, and there's a lot of people that are still choosing the medical route, but things are just changing a little bit with like how people want their lifestyles to be. And so it definitely was impacted back when I applied.
Is so sought after here in Toronto. Like, you can barely get a family doctor to be your primary health professional. And the DSO world is really taking over as well. So like my family doctor works in a DSO called Magenta Group. I mean, he's wonderful. But it's trying to eliminate this, you know, the burden of overhead and having to be a business owner and also a healthcare provider. And I think that's the problem when healthcare becomes capitalized.
Absolutely.
That we are looking to optimize our overhead and looking to optimize everything all the time in order for the bottom line. And it becomes so much more difficult for an independent practice owner. I mean, I own my own practice, and that's really difficult, you know.
Absolutely. Same.
Same. Yeah, looking at the expenses. And I don't have the buying power that some of the DSOs do. I mean, rightfully so, they're buying in volume. That makes sense. But it's difficult. So oftentimes people say, well, I'm going to choose dentistry over medicine because they perceive it to have a better lifestyle. But I look at some people that I know that are family doctors, and like they don't work on weekends, and they work 9 to 5, and their overhead is relatively low because they don't have all the gadgets and gizmos like we do. Right. The markups are still
there's a give and take with all of it for sure. I would agree with you. I think, and it's changing so rapidly. Like, I think you can find people that are really, I mean, there's still family physicians in Texas that are private practice owners. It's a small subset. Most of them don't even accept insurance. If you want to see them, you have to pay for it, which is a totally different market. And obviously there are people that wouldn't be able to do that, you know? But I think if you still have the power to run your business the way you want it to be, well, then you can create this patient avatar that you're like, these are the people that I'm going to attract, because it does allow them the freedom of equipment that they want purchased, not just what the DSO will purchase, or testing, like, oh, they want to do this special test. The patient can pay for it. Fine, let's do it. And so, it's a definite different give and take. The DSO space in dentistry is extremely climbing now in the United States as well. I think
more DSO practices owned in the city of Toronto than there are independent practices. And some of them are getting like, you wouldn't even know. Like, they keep the name on the door.
For sure.
The same. It's like Dr. Joe, such and such, but like really it's private equity that owns the practice and doctor. Yeah. And I think that there should be some transparency. Like, for example, I was in the States a couple of weeks ago, and I went to a Walgreens, and I was like about to pay for something, and behind. And I was totally confused because Canadians, we don't have a Walgreens. So like the labels and things are kind of weird.
Yeah.
So it had like the yellow label and then the white label. And the yellow label was like $3.45 for this like deodorant.
Sure.
And then the white label was like 67 cents. And I didn't understand. So I went up there. I'm like, what is the 67 cents versus this $3? It's like, what they pay for it. So Walgreens, and I don't know why they do it specifically and not other companies, but they disclose what their buying power is. So I thought this was fascinating. I went into the
wow. Yes.
Because I wanted to know. I was like,
totally.
Some photos. I was like, I wanted to know what they're paying for their like Colgate Total.
Yes.
Or like their power toothbrushes. And I will not name names because I don't want it to be like thrown. But if you're listening to this and you want to go to Walgreens in New York City, in the financial district, I'll give you the address. So they're paying for power toothbrushes that my wholesale price is like $23. They're paying $6.
Wow.
And they're selling them for 40s to 50s.
Wow. So they're literally admitting how cheaply they got it, but you're going to pay sticker, like you're as the individual buyer. Yeah, absolutely.
Right. But if you have a Walgreens account, you get 10%
no,
off.
here's the plug.
So I was just like, I'm standing in this toothpaste aisle. I felt like I was like in the Matrix, and the wool.
I don't know that they're doing that in Texas, but now I want to go to Walgreens. Like now you've motivated me to go and look because that's crazy. But that's a big part of it. I know practices that have sold into private equity and DSOs for the same reason. They literally cannot afford to accept dental insurance payments on their patients and still buy the health insurance is broken. Health insurance is massively broken. Dental insurance is broken in the United States. And so yes. And so it's like, it's so bad what these dentists think that they are stuck in, accepting fees that haven't been raised in 20 years when the cost of living has skyrocketed and we are under massive inflation right now. So it's like, it makes it impossible. And so they end up selling. And, you know, I think for some people that's fine. And they can kind of like, okay, I relinquish the burden of having to do that payroll, whatever, but they're still practicing in those practices. So they still have the same issues of like, oh, my assistant quit or, oh, my hygienist quit. And it's like, yeah, so it's a lot. It's a lot. And people ask me sometimes, like, would you still go back to dental school or would you still recommend somebody goes to dental school? Oh, was it? And the fact of the matter is I created such a niche for myself and I love this stuff. Like I started out doing more holistic practices after dental school that attracted a wonderful group of patients that were really in tune with their health. Like they really were coming to me for my advice and they followed it in my preventative protocols and our hygiene protocols. And they were just so happy to have somewhere that they could go and like pick my brain about things. And it wasn't just this robotic, like, oh, here's your free, like, you know, toothpaste or whatever. And so I fell in love with that. Yeah, exactly. Okay. See you 6 months, you know, like in and out in 15 minutes. Like we book an hour and a half for our new patient exams. Our hygienists get a full hour for prophy. They get as much time as they want for SRP. I'm like, you book it. You tell me how much you want.
Let's talk about what that holistic approach. I worked in a holistic practice before I opened
my own
practice. Yeah, you and I have a very similar story. There's
I love this. Oh, stop it. Oh, it's amazing.
Yeah, I did gymnastics and ballet. Like we're
okay, stop.
And now
yes, that's hilarious. So I know. Okay, done.
So
absolutely.
Let's talk about the holistic approach. And it sounds like you had a great experience. I had a great experience and also a questionable experience. Let's talk about how did you cultivate that patient-centric, health-centric practice?
Well, I definitely attribute a lot of it to my dentist sister. So when she graduated dental school a year before me, her husband was playing professional baseball. So she traveled a lot. She really wasn't practicing as much, which gave that girl all sorts of free time to research anything and everything and dump books on me and dump literature on me. And I was literally in the trenches Monday through Thursday, like drilling and filling teeth all day. And she convinced me to start looking into amalgam and where some countries had already banned it or weren't placing it anymore. And I was like, well, we don't place it anyway. It doesn't matter. We're not using that. Like my dad had stopped in the mid 80s. So my parents were already sort of like ahead of making sure that like their sterilization protocols were hospital grade and that like they weren't putting in amalgam. And my dad was hand mixing composite when it came out. You know, there was just like, my parents are the smartest people I know and very forward thinkers. And so I was already like, well, it doesn't matter. We're not even placing it. So like, she was like, I was like, buzz off, you know, like I'm busy. No, like you're living the life.
It's also the safe removal of it.
Exactly. And that's what she had to tell me. Yes. And so she was like, I don't care that you're not placing it. You're removing it every day and dad's breathing it. Dentists have one of the highest suicide rates. And one of the books I read talked about, you know, unfortunately, anytime that does happen, there's an autopsy performed typically. And the dentist had 800 times more mercury in their pituitary gland than the average person that had also committed suicide. Mm-hmm.
Wait, so what's the test? What's the testing? How do they test for?
Well, I don't know exactly the autopsy, how they do it on autopsies, but they do an autopsy. Apparently, if you unfortunately commit suicide, it's very tragic. And I know it's very prevalent in dentistry. And the book that I read was talking about that. And I was just like, oh my gosh, like, what if it is actually harmful for us to remove it, regardless what we've been told? And I'm like, okay, if you put the pieces together, like if a thermometer with mercury breaks in a school, they shut it down for the day. like, oh, but we can just drill it out, and they do. But now they'll say like, well, it's fine if it's in there. Don't remove it. Like if you don't remove it, you're okay. So it's like now we're like acknowledging that removing it is like potentially a threat to our health. And I'm like, for the patient too, we just need to know.
So
they say unless it's shiny.
Yeah, unless it's an active working tooth, working cusp, if the mercury itself, it's always going to be releasing small bits of it. But
100%.
If the surface of it is extremely shiny, then you know that it's constantly being activated.
Right.
And like, did you
Which
do
is most of them if you look at it.
Yeah. Did you do a vitamin C protocol before?
Yeah. So now I do only.
This is totally going off topic. Let's talk mercury removal,
Okay. This is going to get us lots of attention. I love it.
Early on, before knowing you're going to do a removal of amalgam filling, do you start your protocol?
So now I'm doing all airway stuff. But back then I had a nurse that could come to the office to do it. And I knew that there were some doctors that were doing it during, and I knew that there were some doing it after. There is not a lot of like hard and fast guidelines, which I found to be a little bit difficult in the beginning because just like airway dentistry or any other niche, there's a lot of opinions and it's my way or the highway and all of that. But I knew that at the end of the day, what I needed to do the most for patient was do some sort of adsorbent. We did charcoal. People use chlorella. There's lots of different ones, pre and post removal, but then like looking like an astronaut in all the spacesuit, like covering the patient up. The vacuum right here. And we would take pictures of ourselves, like, to let patients know what we're doing. And in the beginning, I felt like a lot of the doctors that I would tell that we were doing this were like, well, I don't want to freak the patient out. And I'm like, I care a whole lot more about my own health. I don't care if it freaks the patient out. You want to keep it in your mouth? No problem. Totally like personal choice. But if you want me to take it out, this is what I'm going to do. And there's 15 other dentists on my street. And if you don't want to do that, like,
someone else,
maybe one of them will take it out. Exactly. Yeah.
Yeah. And there's like other things too that they recommend increasing your vitamin C intake. And in
absolutely.
our office, we would actually we had little packets of vitamin C, and you would put the vitamin C in the water. And like, as soon as the procedure was done, they would drink that like little vitamin C. It was like a shot of vitamin C. And that was supposed to like happen before. We had like a whole protocol that was. Oh yeah, I think that's a really, okay, cool. And then
I know.
So then what? So then you went from this holistic practice.
Yeah. So I grew the practice from like we bought it off of a dentist who only had it open like 2 days a week. We immediately opened 5, and I sat there and twiddled my thumbs with one of my partners for a long time. And we would argue about who was going to go do the hygiene exam and maybe see a patient. And then I started doing this, and the word of mouth and the ripple effect was absolutely crazy. There's Facebook, like neighborhood groups and mom groups. And I learned the term crunchy like years ago. Mm-hmm. And you'd be like in the crunchy moms of Friendswood. And I'm like, what is this? I was added to, and it's like, I need a dentist that's willing to like not take fluoride or like, not put fluoride in my kids' teeth or like whatever the situation. And I'm like, okay, no problem. Like, let's just talk about mouth breathing and sugar intake instead and like not die on the hill of fluoride. And now it's like everybody uses hydroxyapatite. So it's like, I was doing this when it wasn't cool. And now it's like, which is great. I'm glad that's where people are going. But I heard about airway dentistry, and really with the focus on adults, not even kids. My story is kind of crazy. I went to a seminar on expansive orthodontics for patients with sleep apnea because I had started screening, not in office, but I would send patients for sleep studies. If I saw some grinding or maybe like an implant crown kept coming loose or just weird stuff, I'm like, what is your body trying to tell you? Like, what's happening here? And then I would catch sleep apnea, but then I'd be like, call your doctor. Like, I don't know. Like I'm not your girl, And then this seminar happened and I went and listened, and it was like, I am so forever grateful for that, because the guy that was teaching had before and after cone beams showing airway expansion in these patients and like how much healthier their teeth were. And I'm sitting in this auditorium listening to him, on the front row with a notebook thinking like, I'm not going to like any of this. This is all going to be hogwash, like whatever. And every single patient that had a symptom that he was talking about was hitting my mind. Like, I need to call them tomorrow. Like, I need them to come in. I want to do this. So I did this really extensive program. I've since done lots and lots of CE.
Who was the program with?
I started with Vivos Therapeutics, which is actually where the Toothpillow appliances come from. I made up the name Toothpillow because I love that. We use MyoBrace and we use Vivos guides. Depends on what the patient needs. We'll get into the Toothpillow part later. But yeah, I went and did that. And then I did the American Academy of Dental Sleep Medicine has a mastery program that leads to diplomate status. I did all of that. there's just lots of things. And I took an expander's course with Airway Health Solutions, which was imperative. It's actually the pediatric expansion technique that I still use in my practice every single day. And once I started doing that, it was about 18 months solid of doing both biologic holistic dentistry and airway dentistry at the same time. And I reached an unattainable level of burnout in 2021. I was like, I got 2 little kids. No, by then I had 3, and I was still working 4 days a week, and I was juggling, 2 very large areas of the practice. And we had like 5 ops and and 2 hygienists. And I would just remember telling my husband night after night and my parents, like, I'm going to stop all this. And I was like at the absolute top of my career. Like when it comes to like production numbers and income and stuff, it was just like things I never thought possible, but I was exhausted, didn't even cover it. Like, and I was really responsible being that only person in the practice. Like, even though I had a partner, and my dad does implants and stuff, he would come in for that stuff. But when it came to like the families and the need and these sick kids and these sick adults, it all fell on me. And if people would text me after hour, I would give my phone out. Like, I would be like, they'd find me on Facebook. I'm getting asked questions at 10 o'clock at night that I feel the need to respond to. And then I deleted all my social media. One night, my husband just took my phone and he's like, that's it. I'm shutting it all down. If somebody needs to get a hold of you, they'll call the office. I'll be your interface. Like, he just had to like step in, because I was like, I'm really, really good at what I do, and I'm about to stop doing what I do. And I don't think I've ever really gone on a podcast and talked about this aspect for me, because it was such a moment of, I need more space in the office and I need more help. And I told my dad and my husband, I said, if we don't expand this office, I'm cutting my days to 2 days a week. Good luck. Like, I literally said that. I'm like, find somebody else. I can't be the end all be all for these patients anymore. And I found amazing help. We have 12 ops instead of 5. Fast forward 2 years, it's like a completely different life for me now. I'm 2 days a week clinical, two and a half, about to just be 2 days clinical. And I have some incredible associates at my one location, and they're there helping me handle everything so that I can do Toothpillow and do things like this with you. And it was a good moment of just standing up for myself and realizing what I have to do if I want to keep doing this, basically.
Your story is like, you're speaking my language. And I'm actually, yeah. I mean, it gets to the point where like your passion and your ideas grow faster than the time. So you run out of time, and you're either, and if you don't have people that support that change and that growth, if they're not growing with you, they're actually slowing you down. Right. And they put you in this position where you feel like, I'm going to shut it all down because I want these things. I'm asking for these things. I'm hoping that people can do these things. And if they don't do them for you, it just puts you in this position of like, well, then I'd rather not. Like, what is this? I think I've asked myself 1,000 times, like, what is this all for in the end?
100%.
What am I doing all of this?
If I'm not happy, then what are we doing? And
it's not about money, and it's not about like the fame or the fortune or the whatever. It's that. And
there's just things that I can't afford to miss in my kid's life. Like, I can't tell you, like, when our oldest is 9, I have 3 kids, 9, 7, and 5, and our oldest is in 4th grade. And so they're all still in that beautiful, sweet age where I feel like I made the change when I needed to, but we still have a full-time nanny. We still have personal assistants and other people helping us. And I do love that. I think for me to be able to get to this point, I couldn't do it without help, because people tell me all the time, it's probably the number one thing I get is, I don't know how you do like so much. And I always say, it's not me doing so much. It's all the wonderful people supporting me that are helping me do so much, because otherwise I couldn't do it. And there was a book that I read, for anybody listening, that really saved me in 2021. What I did is I cut a day, almost cold turkey. I cut Tuesdays, and Tuesdays was going to be my work on me day. Like, I was still going to have childcare. I was still going to, like, one of my kids was in school at the time, not both, but I was going to sit in here and I was going to read and work on myself and come up with goals and work through problems that I was experiencing. And I read a book by Dr. Sharon Grossman. She's a psychiatrist. It's called The 7 E Solutions to Burnout. Honestly, it was such a divine thing that I even found this book, because I got on Amazon and I searched burnout, and I started just like the number of books on burnout. Okay. There are many. And I landed on this one, and the reviews were really good. Like, because I was kind of between 2. I don't remember what the other one was. And I was like, never going to hurt me to buy it. Now you can't even find that book. It was like $85 the last time I found it. I think she's redoing it and then there's going to be like another version coming out. She's got a podcast, and it took me a year to get to that book because it's a workbook. It's not just like sit down and get motivated like by her. It's like, you're going to read this section. You need to understand it. This is how your brain processes threat. This is how you're perceiving anxiety. And I was like, oh my gosh, like I'm not broken. This is just like when you have limited resources and you don't have the capacity to make the next step. So all the doctors that I mentor now, I'm like, you need to read this book, find this book and read it. And then I'll be here on the other side to help you.
Wow. I think this is a perfect segue for a part 2.
Yeah.
I think in part 2, we should talk about Toothpillow and your mentorship. Now I need to know what this mentorship situation
Okay, sure. I would love to.
Yeah. So thank you for joining us on part 1. For those of you listening, join us for part 2 about more of the same.
Yeah.
Till next time. Peace out.
I feel like we could talk for hours, honestly.